done it. Okay. Hope everybody can hear me. Thumbs up there. Right. Okay. Hi. For those who don't know me, I'm Fran Pitt. I'm a public health doctor and a retired director of public health. And when I worked in Sheffield Health Authority, I used to head up on mental health policy. So this is a subject dear to my heart. I'm only going to say a few words and I've not got any slides. I'm just going to set the scene with the latest on the COVID figures in Sheffield, because the main topics are going to be about vaccination and mental health. And I'm interested in what everybody has to say. Since this third lockdown at the beginning of January, the steep rise in the number of new cases that was happening and was terrifying everybody has stopped and plateaued. And when I gave this talk with graphs 2 weeks ago, I said there was a hint in Sheffield that there was a slight downturn and that we'd sort of plateaued at around 200 new tested positive cases a day. And I'd said, well, we may know more about what the picture unfolds after another couple of weeks. And I'm afraid to say we don't. We still seem to be in a plateau in Sheffield, and it's still running at around, when you look at the 7-day average, which is the best way of looking at trends, that there's a slight hint, but just a hint that there's a downturn in the number of cases. And so it's still sit tight, and it's still the social distancing and isolation is so important at the moment. Death rates, hospital admissions are still high. People are staying in hospital longer because fortunately the treatments are much better, but it does mean to say that people are in hospital a lot longer. And the death rates in Sheffield are sort of running at, about 4, 5, 6 people dying from COVID, Sheffield residents each day. Part of this might be to do with what is called the Kent variant, which I like to call the UK variant of virus, which is becoming the predominant strain of the virus in the UK. And it's now estimated that over 60% of the new cases in Sheffield are the new variant, and it is likely to become the predominant strain in the UK. Say a little bit about the variants. I mean, you will probably know from the news as much as I do. I mean, the South African variant seems to have been getting a toehold in the UK, and there are now 8 districts across the UK, not any of them near Sheffield at the moment, where there seems to be community spread, and the government are putting in quite a few measures to try and get that down. But I do rather fear that it has got its toehold here, and it is a race against time with the vaccination programme. So, as I said, I was only going to set the scene, and that's all I've got to say at the moment. Okay.
Thanks a lot, Fran. And Nick is going to follow now with introduce yourself, please, Nick, and unmute yourself. Thank you.
Hello there. I'm Nick Payne. I'm a bit like Fran. I'm a retired director of public health doctor, but I'm also now a part-time volunteer vaccinator for one of the Sheffield primary care network hubs, doing say about a couple of sessions a week. And I'm still a part-time professor of public health at the University of Sheffield. And I'm going to just say something about vaccination, partly with my sort of part-time vaccinator hat on, but also with the looking at more national information as well. So just bear with me a second. Yeah. Okay, so this is just a bit of an update about vaccination both in Sheffield and nationally. So first of all, in Sheffield, there are a number of sites that are delivering vaccination. There are citywide sites, the Teaching Hospital Trust, the Children's Hospital Trust, not because they're vaccinating children, but I guess because they're vaccinating their staff. And then recently opened the Sheffield Arena. And nationally, there are 130 pharmacies that are that are vaccinating people. I don't think there are any in Sheffield, but if anyone knows any different, I'd be interested to hear that. There are also, and this is where I've been working, there are also 10 primary care network sites in Sheffield. And these are really the ones that for the public that are doing the bulk of the work. I don't know how many the arena's doing, but really the bulk of the work is being done quite rightly by the primary care networks, which are much more convenient for people. They're not so far away and they're in familiar locations and so on. Just a couple of things that have happened recently that, in the last week, really. And it's relevant because we do importantly need some information about the ethnicity of people that are getting vaccinated. So as of last week, one of the compulsory bits of information that's been collected is about ethnicity in the groups that are shown there as one item, and that's going to be very useful. We've already had a week's worth of that data come through, so already there's a huge amount of data that helps us to look at the ethnic differences in vaccinations that are going on. And secondly, the carer status. If you're a carer or if you live in a residential home and so on, that status. I haven't got the full details of those. I couldn't find that easily without a lot of effort. But information is being obtained about whether people are carers or not. So in England, this is where we are. If you go to the NHS England, you find quite a lot of new data that's just come along on the amount of vaccination that's going on. And this is where we are as of yesterday. Well, actually, as of the 31st of January, but published yesterday, about the number of doses that have been given. And you can see that in England overall, we're up to about 8.5, and it'll be more than that now, 8.5 million, more than that, probably up to 9 million. And in the North East and Yorks, we're about 1.4 or 1.3 million. And you can see that the number has been rising for England more or less steadily in a straight line from the early January to the end of the month, which is what the data here goes up to. And finally, this data isn't quite as up to date, but it's the most up to date that was on the website. So this was only published yesterday, and it gives the information about regional differences in vaccination and immunisation. And it goes from the 8th of December to the 24th of January. So it's a week out of date, which is why the total England numbers aren't as high as I showed before. But you'll see that in England overall, 80% nearly of all 80-plus-year-olds have been vaccinated. As you can see on the last column there. It's 2.2 million people over 80 have been vaccinated, about 80% of the total. And you'll see the good news for Yorkshire and the North East is that if you look at the same percentage for us here, 83.7% is the highest regional figure. So that's good. We can sort of congratulate ourselves, all those people that are involved in vaccination, whether they're volunteering to actually give the vaccine or helping to look after people or marshalling people in the car parks and so on, are doing a great job. And we have got the highest figure in the country, substantially higher than London, with only 65.4%. So that's where we are. We're happy as part of this to take some questions and as part of the breakout groups. But that's just a very brief update where we are today.
Thank you very much, Nick. That's brilliant. We'll follow on now with Steve Pagden. I'll do a little bit of an introduction to you, Steve, because obviously Steve's one of the volunteers who are sort of like the beating heart, really, of our organisation. And from day one, really, they've been doing a lot of almost all the sort of actual work that the organisation does. Us old retired doctors do some of the organisation, but the actual work is done by people like Steve. So over to you, Steve.
Oh, hello, everyone. I don't know if you can see what screen you're looking at, whether you can see two pictures or one big picture. Two. This one. This will do.
We can do okay from here, Steve. We can read it.
You can see it enough, can you?
Yeah.
Right, so apologies for that, messing around. First thing I want to say really is a bit of a public information notice. Just literally 5 minutes before the meeting today, a neighbour sent a WhatsApp through, and it was confirmed on Healy Trust, and actually the Healy Plus Centre have got a few spare vaccines. So they're asking for people aged 70 or over or shielding to call their surgeries if you don't get a text. And there's a list of the surgeries there: Sharrow Lane, Gleadless, Healy Green, Matthews, Carfield, Veritas, Totley Rise or Abbey Lane. If you're in any of those surgeries and you know of anyone in those groups, get them to call, and there's a chance of a vaccine between now and Wednesday. Between Wednesday and Friday. Okay, so that's just something that's come through today, and this shows something about the Healy Plus district. It's this purple district here. It's those surgeries I mentioned. It's around about 46,000 patients in the south of Sheffield, and some significant deprivation, particularly in the Gleadless Valley area. But oddly, 2 of their surgeries are in quite affluent areas way out of that area, and that I cannot explain. But the vaccination site is here, Matthews Centre, which is Aslin Road, which is near J.E. James. And of course, many of these people from the other surgeries haven't got a clue where it is. So we've had a few navigation issues over the weeks with snow and that. Clinical lead, Dr. Ollie Hart, who you may have seen on Lock North. He's a big, very good at publicising the PCN and the role of GPs. And I'm a volunteering with SCCT, but actually working under Healy Trust. And the lead there is Andy Jackson, who's done a fabulous job of marshalling the troops. Just briefly, we've run 3 sessions, another one coming up, over 85s, over 75s. And as you've just seen, they're calling for filling some of the over 70s if they can get them in the next session that's coming up. Both the jabs, Pfizer and AZ, have been used. Over 4,000 delivered. Not a single vaccine is wasted. And in general, people are pleased to be having a vaccination. And what's the role of a volunteer? Well, Ollie Hart's thing is remember the games makers at the Olympics. And we are Ollie Hart's vaccine makers. So that sounds a bit happy clappy. And there's a bit of a job in making sure people haven't got symptoms and seeing them through the system, really. But actually, when you start doing the job, you get to realize that people have been in isolation. This cohort of people have been in isolation for nearly a year. This is their first trip, maybe in many cases. Some are very, very nervous and need reassurance. Some are in need of physical assistance. But in general, if you do a good job with people, you find that you get a really positive buzz, and it's a real pleasure to help them and also be inspired by how people are brave enough to come out of their houses in the cold and in the snow and whatever, and in fear of mixing with people to meet people. So just to finish up, a few difficult stories. So who has been missed? Well, we've just seen a message saying that they are trying to reach out to people, but because I'm a volunteer and a neighbour of mine's a volunteer, we realise that a vulnerable neighbour who has no ability to contact the health services for himself, could not receive text messages, was not on the list. So we were able to get him down, but why wasn't he on that list? We do not know why that is, but at least we solved the problem. And then a really, really sad tale was a guy, a gentleman came and he walked through the gate in the last session. He got signs of Parkinson's, you know, very shaky, very agitated, very poor use of English. and he just had some scraps of information with him demanding his vaccine. I think he said something about he'd been to Meadow Hall, and then he'd been to the test centre, which is round the corner on Alderson Road, and basically sent from pillar to post. And he was sat down, and we called his GP, because unfortunately he had a prescription with his GP number on, and they were able to talk to him in his language, and we were able to calm him down, but unfortunately not able to give him a vaccination because he was clearly not from our area, completely from the other side of town. And talking to my neighbour, it transpired, because she was talking to the surgery, that he had refused the vaccine when offered first time, but then realised that other friends or people he knew were getting theirs and he was being missed, and was really concerned about this. So here's somebody who was walked across the city to try and get his vaccination. And I'm going to be speaking out of turn here, because all I do is watch people coming through, a sense in my head who's coming through the car park, and I could not tell you whether the BAME community in our area are adequately represented. I am suspicious that we're a little bit low. I think we might be capturing about half of who should be coming. And so basically why? And I can't answer that question. And I do not know what the next steps to that are. And the other thing we see is sometimes a household has got two people come up, one person supporting, and you do think, well, why can't both these people have vaccines? You know, they're both in similar-ish age groups, but only one has got the invite. And that's just a consequence of the system as it stands at the moment. So if you like, here are a few little issues, but overall it's going very, very well. But here are the danger areas that we're here to look out for. Okay, I'll be quiet at that, and apologies for the mess up with the screen share.
Thank you very much, Steve. That's great. Next, we've got Susie Miller and Abdi Rial from MAAN, and I think they're going to unmute themselves and give their presentation and introduce themselves. Thanks, Susie.
Right, Rial, you can just start by telling people maybe some of the issues that we faced whilst I just set up our PowerPoint.
Yeah, actually, good evening, everybody. Somali mental health, we have actually two strategies. One is how we communicate with the Somali community and advocate or raise awareness about COVID-19, and before that, mental health services. We approach these issues both as health, not only as mental health, but also as a well-being. We have 10 steps that we actually people advised, areas of mental health and well-being. The first is to talk about your feelings. We advise people to talk about their feelings, to come out and talk, because we have experienced a high amount of stigma about mental health. People, they have stigmas, and there was a taboo in their own culture. Therefore, we focused on actually advising the people to express their feelings and to come out and to talk about it. Next slide. It's also during the COVID now.
Can you read it the Somali one out, please, Rial?
Yeah, the other one is get active, or which is in Somali language at the same time. During time of stress, pay attention to your own needs and feelings. Engage in healthy activities that you enjoy and find relaxed. That's the advice actually we provide. So and we advise them to do some exercises regularly, keep regular sleep routines, and eat healthy food. Keep things in perspective. Public health agencies. Yes, Susie.
Can you
Yes.
give some examples of what we've done sort of since COVID?
Yeah, we
sort of like,
have actually a COVID-19 workshops for elderly men and for women as well. We also have an exercise sessions for the females, which is once weekly.
And during the August period, we managed to have some safe park spaces, and we found that some of the elder men were the ones that were the most isolated during the actual first lockdown, and we got more information from them than we've got for a long time. Even, you know, before last year when we tried to get men to come to parks and do activities, they were saying no, we want to stay in the cafes. So their experience of the first lockdown shook a lot of the men, and so they came to some of the park activities and they were playing football with us, badminton, walking around the park. And at the same time, we sort of like made sure we kept emphasizing the importance of being safe and at distance. So we even had a measuring tape to sort of show people this is what sort of like 2 meters is in terms of staying apart, but still doing healthy activities. Sorry for cutting you there, Rial.
Yeah. The other one is about the food issue. On top of eat well and eat a food that is actually more healthy food. That's what we actually approach them, because during the Ramadan times, actually, we published a leaflet to advise the people how they have to eat, particularly and how they could get and how they could find a healthy food, which is a very nutritional and also very good for their health.
And because people had Ramadan in lockdown, that was also a challenge in terms of how people felt about that, you know, being disconnected at a time where traditionally people would have been together, would have shared food. So there was lots of challenges. You know, not everybody has access to social media. Some people have basic mobile phones, not smartphones. So, you know, things like WhatsApp wasn't in the hands of everybody during Ramadan. That number's increased, and part of what Rial's been doing is he's taken the telephone number of men that were on pay-as-you-go, and then he's been topping them up, you know, giving them £10 sort of like top up to, well, not him, MAAN has, but he's the person that facilitated it, making sure that nobody was actually disconnected because of not having enough money to top up their pay-as-you-go when they were using the phone more than usual, in terms of managing how they feel and being able to talk about food or wanting, you know, different choices of food. Are you okay for the next one now?
Go ahead. Kafogo Darogada. Keep away from drugs. A lot of Somali young people actually has fallen into the trap of drug. And what we do is avoid helping them to avoid using to stay away from drugs. Avoiding using helpful coping strategies such as use of tobacco, alcohol, or other drugs. In the long term, this can worsen your mental and physical well-being. That also helps me because I was a smoker before 2020. And at the end of 2000, at the early stage of 2020, I stopped smoking and never light a single cigarette after that. That itself is useful, actually. Go ahead. Keep in touch. This is the most important part, because staying connected and maintaining your social network safely, try as much as possible to keep your personal daily routines or create new routines if circumstances change it. Follow the government recommendations for limiting your physical social contact and content output. You can stay connected via telephone, email, social media, or video. And most of the people actually, they started to communicate, and we start to communicate with them, and everybody has been approached and has been reached.
And again, some of the things that have happened is that in terms of keeping in touch, There have been issues in the Burngreave area in terms of, you know, some of the shops or store holders not maybe knowing what's happening. So a big part of what Rial and Shamake did was actually go to the shops and try to talk to them in terms of, were they aware and do they need support? So trying to make sure that some of the spaces and places where there may potentially people be going because they didn't know, you know, where else to go for information, trying to make sure that those spaces and those sort of like shops of all cultures, not just the Somali shops, were aware and had insights in terms of, you know, safety, in terms of not having, you know, high numbers of people, you know, in the shops at the times when there wasn't the national lockdown, etc. So, you know, it's been different strategies. It's been doing sort of like at distance, sort of like home visits for the most vulnerable. So standing at somebody's doorstep or standing below a balcony if they're in sort of like masonettes or flats, and trying to make sure that you're checking in on people. So we're aware of some people that may be vulnerable, but by word of mouth quite often, some people have phoned MAAN team members or phoned somebody else they know to say, we think this person might be isolated, vulnerable. So we've had issues of people that have been potentially sort of like suicidal. We've had safeguarding issues. We've had issues in terms of, you know, myself and Riali one Friday night trying to get somebody that was self-isolating, quite rightly, because he should do, because he had COVID-19, and trying to support that man to get his electricity, was it, or was it gas? Was it gas that went off for Rial?
Both gas and electricity.
Yeah, his battery electricity. So we were basically trying to sort of like get his fuel systems back on while supporting him to do which he was doing the right thing. And so obviously we sort of like, you know, applaud what he was doing, but trying to make sure that people's support needs along whatever part of the journey are, you know, being there.
Have a rest, take a break. This is actually a good advice, particularly for the Somalis women, because most of the hard work is done at home, and that job is carried on by the women. Therefore, we advise them actually to take a break for themselves and to reflect on the past, or to have, you know, limit their worry and agitation by losing the time you and your family spend watching or listening to the media coverage that can upset, or go to the what we have. We have some kind of activities which is called Shah and Sheko.
Yeah,
and that even it can be we do it nowadays. Women they do it through the website, and that's what another step of making some of our communities as digital literate actually. And they start now to use website to communicate and chat and laugh. That's how to take a break actually.
Yeah. So that.
Go ahead. Seek help.
That's okay.
Or help is different. For example, you could now a few minutes ago Susie was explaining about the self-isolated man who actually he didn't know where to run. Finally, he found out that Somali mental health is available, and he gave us a ring. Therefore, if you're seeking help with your mental health, with your worriness, with your emotional actually needs, therefore, help is available. And we make sure that encourage them to contact us. Voluntary work. Is a long-standing term in Somali language and communities, because many schools have been built through voluntary work and voluntary contributions. And therefore, protect yourself and be supportive to others. Assisting others in the same time of need can benefit both the person receiving support and the helper. For example, check by telephone or video chat on neighboring or people in your community who may need some extra assistance, because helping others will make you yourself happy. It boosts your own immune system. It makes you feel humane. Therefore, we advise them to seek help and to volunteer as well.
So, you know, encouraging people in the Somali community to know that there's options for, you know, volunteering in terms of the COVID vaccination, supporting people to sort of like, you know, as part of some of the discussions we've had at some of the COVID confidence Somali sessions we've delivered, we've talked to people about, do they know people that are isolated, people that are, you know, vulnerable, that may not be in contact? What's been mentioned already in terms of, you know, sort of like, you know, the example that was just given by Steve. It's, you know, do we know somebody that may be like that man that doesn't know that, you know, what do you do if you may miss the first opportunity to sort of like, you know, to respond to any invites for having the vaccine. So, you know, we need to have these conversations. You know, Basra is amazing at, you know, doing the WhatsApp groups and having conversations with some of the people there. Riali's done a really good job at getting men that previously were not on WhatsApp, were not sort of like, you know, connected to each other in those kinds of way, to go from WhatsApp to Zoom, and then, you know, have these conversations about what kinds of things can people do. You know, are there people out there that could be supported and helped to understand what's going on, and having the conversations about what COVID-19 is. This is quite the big, this is one of the big parts of what MAAN has been doing since March 2020.
Yeah. معلومات COVID ka raadso ila lagu kalsoon yahay. This is the most difficult and most hard job, because it is about reliable source of COVID-19 information, about the information of the COVID. Anytime you go and you actually provide the right information to an individuals, actually you will find them next day in the same spot that you found them the last day. Well, this is the difficult task, because there are a lot of social media information going on or flying on over social media, which was, most of them are negative, and most of them are misleading and misinformation. Therefore, we do actually, through the workshops and through the male workshop for elderly people and for men, and at the same time, face to face, we have to face the challenge. Therefore, the information we provide, either with face to face with the social distance, is the most very active, very actually effective one. Well, I would like to come to today's stage where we are actually today. We have overcome all the difficulties. Now we are not nowadays, for the last 1 week, we are not talking about vaccine is safe and vaccine is good, vaccine is that and that, or COVID protection is needed, put your mask or distance yourself. That has ended now. The people now, they came out and they are starting to use their own previously, you know, skill of, you know, managing adversities. What they are now asking is when they are going to have their vaccination. That is the point now they came. Every time we go, we have to advise them, listen, wait for your GP to be contacted by your GP. Some of them, even last night, one elderly person of age 76 told me, he said that he has been received an information and the information is not complete. So what information? I have received information that I have reached the group to be vaccinated. He said, did they give you the address? Did they give you the appointment and all that? And he said, they are not giving me that. And he's very agitated and very angry actually. Therefore, I have to cool him down, say that they are going to send you the appointment and the date and everything. Therefore, people now, they are asking about when they are going to have the vaccination. Therefore, our answer is always to wait. Now we are keeping them wait. Yesterday, we were actually asking them to, advising them to have the vaccination. Now we are asking them to wait. Therefore, there is a lot of change now.
And for some people, one of the challenges is in terms of what's going on is if you are not literate in your first language, you're not literate in English, and you're getting a text message, and if that's the only way in which you're getting the information, we've got to try to make sure, you know, as a team with volunteers, with other people that we're working with, that people aren't dropping through the cracks, that information sort of like, you know, is getting to the people that need it, or people are being supported to understand if they're getting communication, what it means. And that's actually quite challenging. So do you want to do number 10, Rael?
Yeah, that's all right.
So this one's about supporting people to try to remember to continue building personal and community resilience. And a big part of that is making sure that we remind people that it's a hard time. There may be a little bit of a wait before we're going to go back to whatever the new normal is going to be, but trying to, you know, get people to sort of like look after their overall well-being, and take account of the fact that we've all been through difficult emotional sort of like circumstances because of the pandemic. Some of the things that we've been talking about is that everybody talks about long COVID in terms of people's physicality. We need to talk about long COVID in terms of how is that going to change the landscape of mental ill health, because that's one of the big things that we know is happening. We've got a massive increase at MAAN. We've talked to other people in different mental health organisations that have seen an increase in people's sort of like anxiety, stress and depression, and lots of sort of like, the things we've had to deal with. But, it's important that when we look at and talk about long COVID and the after effects, that we need to start thinking about what's going to happen to the people that have got increased levels, or people that have previously not been affected by mental ill health, but have been affected because of COVID. And then the end of that, if you notice, there are 10 satsumas in the bowl, and there's 10 satsumas means that for different people, you choose the different parts of the ways of well-being, and then, whatever it needs, you need to actually sort of like get supported to do that. Make sure that, people are in contact with what's happening. Those people that are able to, keep those that are on the edge and the most vulnerable included, and make sure that as much as possible that we try to keep up to date what's going on. Thank you.
Well, Susan, Rial, that was excellent, and has got us off to a really firm basis, really. A couple of things that stood out for me, really. One is about sort of community resilience and how vital that is, and we've seen a demonstration of that in the slides that you've presented, really. The thing that struck me a bit was a slight difference between the story we heard from Steve and Nick about the anxiety about people from the seldom heard communities going for vaccination, versus the story you were presenting is that they're all clamoring to have it. And I just wonder whether there's a bit of a discussion to be had there.
I think some of the differences that we've seen is that when you've shown some of the videos, I think I've seen Jack. I think I've seen you share some of them. Some of the videos that have actually been shared of some of the imams, some of the videos that have been shared by sort of like BME, sort of like mental health professionals, local people that are trusted. Those people telling the stories and getting the message out. People having information in their first language and having discussions. I think it changes. It doesn't. We haven't reached everybody. We haven't convinced everybody, but there's definitely more people now that want it. The more that they hear their neighbours saying, "I'm having the vaccine," the person that you talked about, Steve, I can see how that happens. Oh, other people are having it now. I'll maybe change my mind. We are seeing that shift and change. It doesn't mean we've reached everybody, but we do know that it's actually having a big impact on people, hearing those stories from trusted spaces and sources and in people's first language, and especially the messages from the Imam that made a big difference. And also our colleague Shamaki, he went on Somali TV, had conversations about it and about challenging misinformations. And many Somali elders are maybe listening to Somali TV more than they are the BBC, ITV or the mainstream TV. So we need to make sure we're recognising different communication points.
Nick, you had your hand up.
Yeah, I think one of the things that's really interesting, what just been said, and what I wanted to just add to that was that one of the indications that if you look at the information that's come out of a recent study about uptake in different community groups and by ethnicity or deprivation or various other things, is that this isn't static over time. That it may well be that that there are certain communities that initially are less keen to take up the vaccination, but actually after only a few weeks they catch up. And if there's the paper that's come out, as I said, recently, the Open Safely study is tending to show that, particularly if you look at the uptake by deprivation, the groups are getting closer together as the longer time goes on.
I think Susie's asked you a question on chat, and I guess that's to you, Nick, about the actual statistics about ethnicity breakdown by areas in Sheffield in terms of vaccine uptake. I guess this is early days for that, but Nick, do you have any indication?
I don't think we've got that yet. We are trying to find a bit more information about that, and we will get better information about that in the next few weeks, as everybody who gets vaccinated is asked about ethnicity. Because at the moment, the studies that have been done in a rather cumbersome way by quite complicated data linkage. It doesn't really matter. It will be much easier to get information by ethnicity and by locality and so on in the near few weeks. Next week.
And the
Tom,
Real.
Yeah, actually, what I would like to add to what Nick is saying is it's true that we cannot reach the whole community because the community is actually dispersed in Sheffield. From, some are in Healy, some are in Dunall, some are in Broomhall, some are in Fed Park, and some are in Bangrave areas. But what we are talking is the largest number that we reach actually, because most of the areas you could find the Somalis are in Bangrave area. That's the area they came for shopping. They don't go shopping any other place. The Broomhall people, they shop here in Bangrave. The Dunals, they shop in Bangrave. The Fifth Park, they came here and they shop here. And the place they meet, where they have got actually their coffee shops and all that area is in Bangrave. The mosques where they go to pray are mostly in Bangrave. Therefore, you could find a lot of population Somalis in Bangrave area. Therefore, when you ask them and you contact with them, because most of my time I spend in Bangrave area, and I stay there near the post office and ask them, they'll ask you anything news about the vaccine, anything news, and they ask you the information, the misinformation they hid the night. In the morning when they see you exactly, they'll ask you. They come first of all say, I heard last night one person named a doctor himself, he's saying this, and you have to explain to him. Therefore, the other issue is, whenever they trust you, they listen to you. The most important thing is when we are going with them, because it needs the people they actually trust. And when you tell them, frankly, say that this is a medicine. For example, last week I was in Dunall COVID-19 meeting, like something like that. There was actually some kind of one of the person who was talking about the vaccine contains alcohol, something like that and that. Therefore, there was a lot of issues on that side. You have to explain. The media, the Somali media, the national TV of Somalia and the BBC World, which is the Somalian language is broadcast, all of them, they actually send a message that the vaccine is safe. Therefore, the people, they listen to BBC World Service in Somali language, and they listen also to the national TV and other independent TVs that are broadcast throughout the world from the Somalis in Somali language. They listen VIO Somali language, BBC Somali language, Cairo Somali language, and Rome Somali language radios and all that radios. They have got all that information in terms of the radio. At the same time, when you actually give them the same information face to face, they take. That's why we say that a lot of people now, they are very keen to take their vaccinations. Yeah. A colleague of us which is Basra, her husband is a medical doctor, and he refused actually to take the vaccination himself, but later on he has been vaccinated. We have also other peoples to use them as an example, which are scholars and people who have got names in the Somali communities in terms of their education or scholarship or scholars or something like that. And when we tell them that Mr. So-and-so has been vaccinated, and you tell them, I'm vaccinated myself, and tell them, therefore they say that, why? There is no problem then. Therefore, that's why we could say there are a lot of people that are coming and willing. The person who was asking last night at 8 in the evening, he rang me and said that I was ringing you the whole day. Where were you? I said that my telephone was, and I was engaged. I said that, listen, I have been sent, because he was one of the most difficult, hard to convince them, because he was a teacher as his background. And it was very difficult to actually convince him. But last night he rang me luckily and said that they sent me to have a vaccination, but they didn't give me the address and the time. He said, are you willing? Yes, he said that. Therefore, there are a lot of people now who are actually accepting.
So that's the point I think that was being made,
Yeah,
basically, is
yeah.
that there's
Good,
been a
thank
change. I think we should try to find out whether we're going to go into some smaller discussions now.
We are. There's one more presentation now, please, from Sue Milchard from Sheffield Samaritans, and then we will break into small groups. So, Sue, over to you. If you introduce yourself, that's great.
Thank you very much. Follow that, crikey. I had the privilege of meeting some of the people from MAAN about 15, 16 months ago. Really interesting day that we spent with them, and I took away such a lot, but also had a marvellous lunch, so I recommend it if you ever get the opportunity. They are fabulous cooks. I'm also, we talked about talking this called Struggling to Cope, but actually I might pinch one of Raoul's headings, which was talk about your feelings, because that's what Samaritans is all about. So my name is Sue, and I am a listening volunteer with Sheffield Samaritans, which pretty well means what it says on the tin. I'm just going to whiz you through a little bit of the history, what we do, and how we may be able to help. So I'll start off with a couple of statistics. They come from 2019, but they're the latest that I've got. So every 7 seconds, Samaritans answers a call for help. And every year, our volunteers spend 1 million hours responding to calls for help. We've got just over 200 branches in the UK and the Republic of Ireland, and that means 20,000 plus volunteers. In 2019, we reached more than 1.2 million people through our work in the community. Although if everybody's records keeping is as bad as mine, I suspect that number is a significant underestimate. Suicidal feelings are mentioned in 1 in 4 calls. We are not only there for people who've got suicidal feelings. In fact, in many respects, we want to get to people way before they get to that point. That if people are having suicidal feelings, suicidal thoughts, we're there to help. If you take nothing away from the next 5 minutes or so, please take our telephone number, which is 116 123, and I will repeat it several times. It's a free number. Samaritans was founded in 1953 by a Church of England curate called Chad Vara, who was a curate at the time, and he had attended the funeral of a 14-year-old girl. She had taken her own life. He was quite distressed by this, and when he investigated further, he found that she had, her periods had started, and she didn't know what was happening to her, and she thought she had a terrible disease. Sorry, I find this so difficult. And so she killed herself. And he thought if only she'd had somebody to talk to. So he started being that somebody to talk to in about the November of that year. By the December, word had spread, and the Daily Mirror christened us the Good Samaritans. In February, he realised he couldn't cope on his own, so volunteers started to take calls, often from their own homes, which we absolutely don't do now. I'm not sure when we formed into branches, but that was sort of the start of us. 20 years later, in 1974, Chad Vara founded something called Befrienders Worldwide, which is now in 32 countries. We are, despite our origins, we are a secular organisation. And I'll just mention in the context of suicide a little bit of pedantry on my part. We don't talk about committing suicide because you commit crimes and suicide is not a crime. However, it was a crime until 1963, which is fairly horrifying really, isn't it? But we don't talk about committing suicide anymore. So who calls Samaritans? people struggling to cope, people feeling overwhelmed, people who feel that they've lost control or they just can't deal with what's facing them. But there's no typical caller or call. Everybody says, oh, what's a typical call? And there isn't a typical call. People will talk to us about anything that you can think of, about work, money, family, loneliness, health, physical and mental, bereavement, abuse, suicidal feelings, sexuality, self-harm, and of course COVID. The view I take is people will always start a conversation with, I'm sorry, I'm not suicidal, is it all right to talk to you? And my view is, if it's keeping you awake, you need to talk, and we will be here to listen. On our website, we sort of sum this up as saying, whatever's life's done to you or whatever you've done, we're here. And it's that whatever you've done that is also quite interesting. When we were training in our sessions on empathy, one of the handouts said, could you empathise with a paedophile? And I can remember the sharp intake of breath from a number of people, including myself sitting around the room. Can I empathise with a paedophile? And the answer is yes, I can. Because when I am being a Samaritan, I am not there to judge. I am there to listen to whoever feels the need to talk. So we're there when people need somebody to talk to. We listen, we help you talk things through. We do not judge. We're anonymous, which is really helpful, because we are literally just a voice on the end of the phone. I mean, you can see me, so you can form judgments about me. When I'm just a voice on the end of the phone, you can form perhaps fewer judgments about me. I will not disclose anything about myself. It can be quite difficult when you get the sort of somebody who's talking about children, saying, have you got children? Well, you don't. You deflect questions like that because the call is not about the Samaritan, it's about the caller. We offer a confidential service. Obviously, safeguarding can be an issue, but frankly, it seldom is. I don't have caller ID. I don't know who's calling. I can't trace a call. So confidentiality is pretty solid. We don't give advice. Sometimes you have to find a way to say something like, do you think it might help if you spoke to your doctor? You persuade yourself that that's not actually giving advice. We help explore options, because what we're trying to do is to give that control back to the individual. So what are your options? We'll help you explore them, we'll support you to make your own decisions and help you gain that control back. And that is really important, particularly at the moment when you kind of feel helpless. And I feel completely helpless a lot of the time. This is just happening, it's being done to us. I can't go out, I can't see my kids, all of that kind of thing. And we will explore suicidal feelings. It used to be a compulsory question. And people who run us frequently would often say, I'm not suicidal, so you don't need to ask. We don't do it quite as blatantly now. We are here, and this is the important thing, 24/7, every day of the year. And quite often at night, we are the only people available. So if somebody is in real distress, or everything just seems so much worse at night, we're often the only people who are there to call. People contact us by phone, by email from all over the world. That astonished me when I first became a Samaritan. We've actually got a correspondence branch where people write to us, and we can't do it at the moment, but face-to-face visitors are, in normal circumstances, welcome. We're based in Queen's Road, back of beyond really, so you don't get very much passing trade, as it were. If you were in the middle of town, you probably would. So we don't get that many face-to-face people. It's difficult to get through to us sometimes. Any phone call will be answered, but the wait can be long because COVID is affecting us too. You'll appreciate that a lot of Samaritans are older people, and they have health problems themselves, or shielding or whatever, or for night shifts, perhaps don't drive, don't want to take a taxi to the office, and don't want to car share. You can't car share. So we're struggling a bit to keep going, but we are keeping going. Talking Talking is important. We listen, we focus on the caller. It's not for no reason that a trouble shared is a trouble halved is a cliche. Callers often feel calmer, they see things more clearly, and we help to give them that first step to seeking help for themselves. It's astonishing how many people will say, I've never told anybody this before, which is a real privilege, actually, but that's how it is. And who are the Samaritans? Well, we're all volunteers. We have paid people in central office, small central office. We have a paid person who does the admin, but the people on the end of the phone are always volunteers. We have to be more than 18 years old, but that's about it, really. There's no typical Samaritan. It's not for everybody. People will select themselves out for a number of reasons. Our attitude to suicide is one that can sometimes cause an issue. And for people with very strong religious feelings, it can be difficult because we're a secular organisation. We're trained to listen. That's the only thing. We're not professionals in any other sense. And it can be a bit tricky sometimes because we do have doctors and lawyers and all other kinds of professionals volunteering with us, but you have to put that to one side. So even though you know, you think you know the answer, it's not appropriate to sort of engage with it. You don't give your own opinions, you don't give a professional view. And the other thing that we must never ever do is say, I know how you feel. Most of us are in Samaritans because of something that's happened in our own lives. And sometimes you will talk to somebody who has an experience which might sound very similar, but it would be completely wrong to say, I know how you feel, because I don't. I know what's happened to you, but that's not the same. We do signpost to specialist services, and you know, always on the lookout for local ones, although we're a national, our telephone number is national, so you dial that number, you could speak to somebody in Land's End, John O'Groats, and all points in between. Previously, when we used a Sheffield phone number, but you had to pay for that, it was good in the sense that you felt a better understanding of the callers, you could sort of picture them, but we got through to less people, I think. It's incredibly rewarding. It's the best thing I have ever done. It can be very distressing, lying if I said it wasn't, but the branch and Samaritans generally are very supportive because obviously you can't take anything outside the branch. One of the things I'm responsible for in Sheffield Samaritans is our outreach work, and it's been an incredibly frustrating year because we haven't been able to do very much, but we have been involved with the schools, the universities, Network Rail, we've worked with the police, we've worked with the NHS, community groups, giving talks and workshops, Sheffield suicide prevention groups, and at the moment the grassroots football are trying to get involved with us, which is really interesting because there's a lot of men involved in that, and that's kind of a target demographic for us. It's mostly a free service, but you know, we do welcome donations because we are a charity. If you go onto our national website, samaritans.org, there are a couple of things I just draw your attention to. One is an initiative which is probably a couple of years old now, and it's called Real People, Real Stories, and it was a huge piece of work trying to encourage men to talk, and those are the real people and their stories are on our website. The thing to mention is a self-help app, which is about helping maintain emotional health, and again, you can look that up if you want to. Our telephone number again, 116 123, and I'll stop now. Thank you.
Okay, thank you. So if you can put that onto the chat room, the number, that would be really good. And now I'm going to ask Ian to put us into breakout rooms, and maybe when you get into your breakout room, just say, you know, introduce yourselves to each other, and then there's discussion about the mental health effects of COVID. Thank you.